I'm going to probably stay awake better, right? My name is Orville Haid. I work with the pharmacy, Northern Avenue Pharmacy in compounding. My last name is what?
Wade.
Wade Haid. What's not Redenbacher, right? You didn't hear that? That's why you're going popcorn tonight. Sorry. My pleasure to introduce you to Dr. Joy, who is doing the presentation tonight. I just want to read real quick a little bio for her. She is a board-certified family medicine physician who has been treating patients for over 20 years. She graduated from Philadelphia College of Osteopathic Medicine and completed a residency in Kingston, New York. She went on to serve as a physician in the Army at West Point and Aberdeen Proving Grounds. She settled down in Franklin County over 15 years ago to be closer to family. By the way, if you're interested at the end, she has a nice little brochure about her and her practice. So these are laying here when you head out if you're interested to pick one up on the way out. I only say this, I have less than 40 or 30. I think I have 20. So we may have to auction them off if there's a high demand. They're all it's here. You never know. Dr. Joy.
Thank you. Very happy to see everyone. Thank you for coming. I just wanted to start off by showing you a couple cells that are in the body and just about how active the cells are and what miraculous things it can do. The zillions of processes that go on in our bodies and in our cells every day, and it takes a lot of things to get a lot of nutrients and things to make everything work right, and I think that's what our seminar is about tonight. But just to give you an idea, all those little things are going on in your cells every day, tons of them, and we have to provide the correct nutrition and other things for things to work correctly. And this is an example, actually, the little one's a T cell, which is a cell that actually can fight infection or cancers. That's from the human body, and it's attacking a cancer cell. So the cells in our body are miraculous. They can heal. All the processes they go through every day, it is just amazing that anything gets done right. So we kind of have to treat our bodies correctly and give the nutrients it needs. So that's just an example of that. I'm going to switch you over here. Thank you.
Thank you.
And one of the reasons we're here tonight is because as over the past 100 years, the life expectancy has gone up quite a bit. Back in the beginning of the 1900s, life expectancy for someone was like 31 years. And because of medical advances and things like that, it's gotten a lot longer, up to 73 years. So what we're trying to do is provide ways that we can help our bodies last long, be healthy, and avoid any kind of disability toward the end of our lives. So that's what our talk about is tonight. I just want to let you know there's some things we're kind of behind the 8 ball on. Over time, we've kind of been misled about certain things. Of course, we all know tobacco is bad for us, but I'll tell you a story. Back when, I guess, the late 1950s, President Eisenhower had a heart attack. He actually smoked 4 packs of cigarettes a day. And they thought that the people in the tobacco companies and other industry thought it really wasn't a good idea to blame the heart attack on tobacco, even though they knew it at the time. So they were deciding kind of how to address the nation and tell them, what we should be concerned about. They were thinking it had something to do with sugar, but they didn't want to say that because the government had a surplus of sugar for food that they were trying to utilize and sell. So they didn't blame it on sugar, but they thought they'd blame it on cholesterol. And cholesterol is a problem, but it's not the only culprit with our disease and our chronic diseases and disabilities. So that kind of information, we've kind of been misled. So we're trying to move away from that and do the exact things we need to. One of the big ones is avoid a lot of processed sugar. So that's just the other thing, one of the other things we're trying to change is that we don't want to wait till a disease process happens. The pharmaceutical companies fund 75% of the FDA. So what they're doing is getting, hastening the drugs that come out, and but we would rather prefer to not have disease and disability and keep it that way toward the end of life, rather than wait till something happens and take a medicine for it. So we've had some undue influence with the FDA and the drug companies, just trying to say, we don't have to do anything right now, just wait till the process happens and we have a cure. Other things we have to address are the food and water supply, and in the air we have pollutants that include a lot of plastics and environmental toxins. So that's another thing we have to kind of work against. And the additives in our foods, some of the preservatives and the high fructose corn syrups and the concentrated sweets. That's another thing that has been placed in our diet. The abundance of the sugar is just been kind of thrown at us, and we have to learn that that's not the best thing for us. So, and again, this is just showing that carbohydrates do play a role in heart disease. It plays a big role in a lot of disease developments, even from Alzheimer's, of course, diabetes, and other things. But diabetes, heart disease, and Alzheimer's are big things that we want to prevent, and we can if we try to avoid a lot of excess carbohydrates. And this is the latest food pyramid, which tells us the best foods to eat and the amounts. If you remember, our original food pyramid actually came from Sweden back in the 1970s. That actually said it was okay to eat a lot of actually breads and processed sugars and other carbohydrates. They said we could have up to 11 servings. That is actually not correct. There was some other influence of the food industry that waylaid the accurate information getting on the FDA or the food pyramid. So, but this is the latest. We, of course, want lots of fruits and vegetables. If we do carbohydrates, that includes a lot of the fruits. But if we want for carbohydrates, we need to have whole grains or things like nuts and beans and things like that. Another thing we'd like to have in our diet is lean proteins. Some of the red meats have a little more saturated fats in them that we'd like to avoid, but any kind of lean protein would be great. And we would like to have 3 to 4 ounce servings 3 times a day. That would be the best, as long as you don't have any issues with your kidneys or other kind of medical problems that preclude you from having protein. And then, of course, we do need the healthy fats. Cholesterol did get a really bad rap with the heart attacks. You can't have a lot of cholesterol, but we do need some, because it is essential for building hormones and things in our cell membranes and things like that. So we do need to have some, we just have to have the right kind. Another thing that people kind of let us stray on is that the vegetable oils and the seed oils have a lot, or they were okay to use, the canola oils. That is not the best thing for us at this time, just because of the way they're processed and the type of fats they have in them. The best things, if we're going to use oils, is the avocado, the olive oil, and hang on a second. Coconut, yep. I don't know why I'm drawing a blank there, but yes, you got them. You got them. You know them all.
I have to eat them.
So at this point, what we're trying to do is transform the way we've actually thought about healthcare. We've had a lot of patients over the years. I've been doing this for a long time. Usually people come in and see me if they have symptoms or they develop a problem, and they have to come in and I have to treat them. But the best way to do it is to try to live a healthy life from day one. And a lot of that hasn't been done previously, just because we've had a lot of advances in science, and everyone can think that, okay, well, I'm good until I have something really detrimental. But it is best to avoid those detrimental things like the diabetes, Alzheimer's, and heart disease. Another one is like osteoporosis. We really need to eat healthy to avoid that also. It is a whole person approach. I mean, we need mind, body, and spirit to have all this work in coordination to develop healthy habits, to decrease stress, because stress plays a very a vivid role in creating obesity, weight, or insomnia, and other things like that that really wreak havoc on our bodies, actually. I mean, that's kind of, because as I was showing you, the cells have a tremendous ability to repair itself, and there's tons of things going on. We just need to give it the right nutrients and the proper treatment or the proper care. And again, this is something we have to start from day one. We need to be aware that we have to intentionally take steps to avoid having chronic disease or disabilities. And once we realize that, we have to take the proper steps on a routine basis. We also have to monitor any kind of changes or things that we do, just to make sure we're on the right path, because sometimes the things we do aren't necessarily evident in lab testing and things, so we can determine from those labs if something needs to be changed. So we keep an eye on any kind of vitamin labs and blood counts and things like that. Also, hormone levels, we monitor all that throughout. All right, so again, we want to know what kind of symptoms you're having initially. We want to start healthy, and we want to maintain rather than just waiting for a disease process to start or become evident. And a big part of this is the sugar. We want the cells to work well, but a lot of sugar can interrupt any kind of cell function and its ability to do its job. So, and again, we just need to start with a different approach. Be aware, maintain, monitor with the testing, and have an intent to take care of it. Did everyone know what diabetes is? Anybody? Does anybody know what the different kinds are, type 1 or type 2? Anybody know what type 1 is? No? What's that?
It's adolescent diabetes.
Yes, they call it adolescent.
Yeah.
Mm-hmm. Do you know why they call it adolescent?
Because, young people
You notice it when they're first young.
Yeah, they're born with it.
Right, and that's because we notice it because they have no insulin at all. So that's type 1. You have no insulin at all, we are going to have to give you insulin in order to treat it. And type 2, does anyone know what that is?
Old age.
Yes. We used to call it the diabetes of old age. But then we started having people with diabetes, get it in their 40s and 50s, and we don't want to call 40s and 50s old age, not at all. So we had to kind of change it to that's the diabetes of being overweight or obese. But now we see diabetes in a lot younger, and so it's type 2, but now we're seeing it in kids even. I think my youngest patient with type 2 was 15 so far, which is very bad.
Was he obese?
Yeah.
Oh,
He's overweight.
very obese,
Yeah, pretty much.
because now, 70% of the population is obese.
Well,
Does that mean
70%.
they're
Right.
diabetic? They're too.
70% of the population right now is obese or overweight,
Yeah.
and we have at least 10% that are known type 2 diabetic. So we want to change that. Because back in 1970, you rarely saw diabetes in that kind of situation. So it has to be something that we're doing because no other country has this kind of epidemic. And the sugar does impact the coronary arteries too, where it creates changes in the cells of the lining of the vessels. It damages them. That's the start of the coronary artery disease. Then cholesterol comes, the bad kind. It forms plaques and causes the occlusions, and that's what causes heart attacks. But again, initially it starts with very high sugar. So that's, sugar wreaks havoc on every part of your body. The brain, the eyes, the kidneys, the nerves, everything, blood vessels. So we really need to avoid high sugars to get rid of those chronic diseases. Does anybody know what some of the symptoms of heart attacks are? Anybody at all? Heart attack? Chest pain, right. Chest pain's one of them, yes. And then some of the other ones are you can have like left arm pain and jaw or and nausea or sweating and things like that. And 50% of the time, people, when they find out, the way they find out they have coronary artery disease is because they end up in the emergency room with a heart attack. We don't want that. We want to prevent the heart attack. So we want to prevent you from developing coronary artery disease. Again, because some people don't even know they have it until, you know, they have a heart attack, and that can really do a lot of damage to your body and create disability. So, here's where we have the cholesterol, the good and the bad. So the bad we don't want a lot of. It actually can be useful. We make steroid hormones out of it. It's incorporated into our cell membranes. So we do want some. The good cholesterol is called HDL, and that we want a lot of because that molecule actually helps with the plaque. It gets rid of some of the plaque. It carries the bad lipid out of the blood and away from plaque. So we want a lot of the good kind. We do need some of the bad kind. So we can't eradicate it all together, but we just have to monitor what types of cholesterol we're getting. And the high sugars also actually create problems with the Alzheimer's disease because that causes neuron damage, it causes cell damage, it causes inflammation in the brain. It leads to the development of what we call amyloid plaques. So that is what we find that's what is deposited in the brain of those with Alzheimer's disease. So we would, again, prefer not to have a lot of that sugar, high sugars, which creates a lot of damage to the brain. So this is why we think we can actually avoid developing Alzheimer's disease. We don't have any medicines really for Alzheimer's disease. We have ones that say that can slow the progression, but it doesn't do a very good job, and there's nothing that reverses it. So again, we want to prevent it from occurring in the first place. And that just another slide showing what creates the problem. One of the other things we want to try and prevent is osteoporosis, and we can do dietary changes, exercise, and weight training in order to make sure we prevent that sort of thing too. The other thing we like to do is check vitamin levels and hormone levels because they will increase testosterone and increase estradiol will also build bone in addition to the vitamin D and the weight training. So we're trying to prevent the osteoporosis also. And osteoarthritis is another one we can try to prevent because the thing that impacts osteoarthritis the most is the obesity. It wears out joints, and the cartilage in the joint will just start to degrade because of the stress from the weight. Again, so we're trying to avoid that kind of weight gain with the intense or the high carbohydrate content of foods, especially processed. Other risk factors for osteoarthritis are age and genes and accidents, but again, the obesity is a large one. Once you start to have knee pain and it's bone on bone, there's nothing we can do other than a knee replacement. But if you're not a candidate for knee replacement, again, that leads to a lot of disability. So what can we do to change a lot of these things? First of all, there's weight management. We want to maintain a healthy weight. We don't want to be really thin, but we'd like to have a BMI. Does anybody know what a BMI means?
Body mass.
Yes. And where should everyone's be? Or where would we like it to be? Less than what?
20.
30, 24.
Less than, yes. 24, they say 24 to 20 is good. I personally think that's a little too strict because, it doesn't take into account bone density, muscle mass, and things like that. So you kind of have to go on an individual case. But right now, the way they determine that for the way statistics, it's 24 or less. 25 to 30s, they say overweight, and above 30 is the obesity. again, I say it can be a little more than that, but you have to take that on a case-per-case basis. But weight management comes by avoiding a lot of excess sugar, processed sugars, the ones that are not whole foods and things like that, like any kind of processed food. Anything you find in a package, a box, wrapped in cellophane, that's going to be bad for you, so usually. Let's see. And of course we do have medicine which will address this. Since we have had so many, a lot of misinformation about what is actually healthy for us or what helps us, and the sugars have been prevalent or pretty predominantly available for our food sources, we do have medications which can help us regain a manageable weight. Those are the latest ones called the Ozempic and the Mounjaros and things like that. They help your body either produce insulin, which is necessary for the degradation of glucose to be used by your cells for energy. So insulin is necessary for that. Those newer medicines also help decrease appetite. They slow the motility of the intestine and the stomach so that things can get absorbed easier. They actually help a lot with cravings. So we're lucky we have those. The pharmaceutical company came up with them for now for us to backtrack. But it'd be nice if we could have known some other information sooner and then avoid that, but they do help. So we also need to incorporate exercise. We would like to have a lot of cardiovascular exercise. They say 30 minutes 5 times a week, which would be, that would be fabulous. Somebody who's starting a new exercise program, a lot of times they say, oh, I can't get out to the gym, and that's perfectly fine. If all we can do is have you get up off the couch and walk out to the mailbox, that's all you can do today, then do it. If maybe tomorrow you can, walk down to the corner stop sign, that's fine, get out and do it. You can start very small and, get gradually to 30 minutes 5 times a week. But, we just have to start from somewhere. But the exercise is very important. The other thing that helps is the muscle strength. We need to have strong muscles to support, obviously, the skeletal system, but they also help us remain healthy through the end of life, because toward the end of life, we tend to have muscle atrophy, which we don't want. That comes from just inactivity, age. The other thing is hormone levels can decline, which would cause that. So we would like to build up good muscle strength early on in our years. Well, actually, I just want to demonstrate, and again, any kind of exercise is good, however you can get to strength training or the aerobics. So can everybody stand up for me? Just real quick. Okay. So I'm going to have you just put your hands right in front of you like this. And we're going to have you just lower, bend your knees and start to squat down. Okay? Now, if you can, hold it there. We're going to hold that for 10 seconds. 4, 5, 6, 7, 8, 9, 10. Come up. Okay? And going back down. That really helps your quads and your hamstrings. So, even doing just something like that. You don't have to get out and run down the street. Just any kind of chair exercises or things like that, which would help. And of course, you guys sit down. But obviously, your physician or someone can help you develop a more better, longer program, or any kind of trainer you may have, or just a life counselor can help with that.
So that's for lower body strength.
Mm-hmm.
How about the upper body strength?
Well, you can. Do you want to help me out with that? What do you do?
What do I do?
Someone behind you. Yes. Do you know what we can do for that?
Oh, upper body.
Yeah.
You do a shoulder press with
Yes.
like a water
Yep.
bottle.
Yes,
soup
exactly.
can,
With weights or so?
Weights.
Weights?
Yeah.
Just-
Anything
you
else?
can do things with a cow at home.
Yes, yes you
know?
can.
I mean, there's things that, I teach at Mental Haven.
Okay,
exercise,
okay.
so, yeah, there's many
Okay.
things that you can do with
Okay.
objects from your own home.
Yep. How about your how about your core? Anything you can think of for that?
Oh, from a chair, if you sit on the edge and you pull your knee in towards your body,
Mhm.
just one leg at a time. That, if you draw your belly button back towards your
Yes.
spine,
Mhm.
make sure you breathe out.
Yep, just,
Yeah.
and you'll feel your muscles tense up when you do that kind of thing, but that's all you need to do. And
Very simple.
you don't need to go out and, do some gymnastics to take care of that, so. So the other thing that would be really beneficial also, again, is the low carbohydrate diet, because it reduces a lot of the concentrated sweets. A lot of those processed foods also lack a lot of nutrients. If you're going to eat any kind of carbohydrate, say for example, if you had a piece of bread versus an apple, which one should you eat? Yes, does anybody know why?
There's more fiber.
Yes, more fiber, and it has like some
And more
vitamins in it, and
vitamins.
things like that, yes, so that's great. So if you have to eat carbohydrate, at least try to put in some fiber, some nutrients, vitamins, or protein. And it's not the best thing in the world to do or to eat, but pasta and cereals actually know that now, and they actually put fiber and protein in some cereals. So if you're going to eat cereal, try to eat that kind. If you're going to eat bread, they also do that with the bread, and they also do that with pasta. So if you're going to eat those things, try to mix it up with that. The other things that are good carbohydrates to eat are like, they don't have a lot, but like beans and nuts, they have protein and fiber, and they have carbohydrate, but not a lot. So that'd be a better thing to eat. And we could say, well, let's just do that low keto diet and not eat any. That's not very healthy either, because you do need some carbohydrates, because your brain uses that glucose for energy. So we have to have some, but we just like it to be the kind with fiber and protein and nutrients in it. Whole grains, anything that's organic or whole foods.
What about tomatoes? I mean, I love tomatoes, but now they're saying they're bad, or you shouldn't eat as much, or...
Well, you can have a tomato. I mean, you can eat tomatoes. You just have to consider that part of a carbohydrate serving.
Okay.
Like if you say I'm only having 5 carbohydrate servings today,
Yeah.
that would just have to be included as part of that. That's all. Yeah. Specific things to eat for prevention of Alzheimer's are berries, leafy greens, fishes that like salmon have a lot of fat in them. The better kinds are raw fish, but I don't, we don't have that too much around here. And nuts and seeds, they're very good for your brain. And then there's my list.
There we go.
There's my list. So the healthy oils that are fats we need are the olive oil, the avocado, and the coconut. And we've been eggs have been going back and forth. Does anybody know what's the word on eggs now? Yes, yes. They're expensive. Maybe that's why now. Eggs are okay to eat. They do have a lot of protein. The white part is all protein. The center part is where a lot of the cholesterol comes from, but it's okay to eat. Again, we do need some cholesterol for cell health, so they're okay to eat. They do have a lot of nutrients in them.
So you eat both parts of the egg?
Yes,
I mean, not just the yellow, the white part, or...
right. You should eat both parts. And if you're going to have breakfast and it's a choice between cornflakes and eggs, which one should we eat?
Eggs.
Eggs. Yep. Yeah. Or even Cheerios. I think the eggs are better to eat than, how they say Cheerios are heart healthy.
Yeah.
Well, I'm not sure it is
Compared
because,
to what? Yeah.
yeah, right, because it's just sugar.
Yeah.
I guess it's not like eating a pancake with syrup, but still. So the other things we have to keep an eye on or make sure we get enough with essentials are vitamins. It's best to take a multivitamin one a day with 100% of the USRDA because we don't get enough in our foods. We can't, it's just, we'd have to eat an awful lot of vegetables and fruits and things like that in order to get enough of the vitamins. So I'm sure everyone knows what vitamin C, that's one that improves our immune system and actually helps with skin. So it's very, we have to have that, and these are all need to be supplied by our diet. But again, we're not sure if we're going to get a lot in our diet, so I recommend taking a multivitamin with it in it. And these things should be monitored also. One of the things with the I guess personalized or functional medicine we call it, is once we know these things have to be addressed, and we do monitor labs just to make sure we're on the right track, because we don't want to be taking something like a vitamin D and all this, we take a look at it 6 months later and your vitamin D level is still low. Well, that thing wasn't very good. We have to try something different. And so we do have to monitor these things, and how often is just depends on the individual. Sometimes we could monitor them. It depends. If you're trying to adjust something or find out the reason something's not optimal, we could do it, every 3 months. But if everything's perfectly fine and you're doing the same thing day to day, we might check these once a year or so. But we do want to monitor them. We don't want to just assume everything is great, because I've had people taking some things, even like hormones for supplementation or optimization. They've been taking them for years, and we take a look at their levels, and it's not there. And it's either because the form they took, or the digestion, or they took it with another kind of medicine that didn't work. So you do have to take a look at these things. And vitamin B12, that is usually supplying a lot of our energy, and it helps with brain health.
Can you take too much B12?
Well, according to levels, yes. Like, there is a certain level that we go up to, but yeah, you can take too much. It's not going to do any real harm to your health, but you don't need to take any more than, it depends. But we go up to like 1,000 on the normal for that, so 1,000 or 1,200. So we try to keep it below that, just to, that's all you need. You don't have to take more than that.
What foods are good for B12? Are there any?
Yes, there are. It's animal proteins and other foods that would have it in it, but it is difficult to get. So I would say probably, again, that's one where we have people take a multivitamin. I'm sorry, it isn't a multivitamin, but sometimes we have people take particular just a B12, because that is difficult to get. And of course, there's vitamin A that does really good things for your eyes. And does anybody know where we can find vitamin A? Carrots, yep. You'll turn orange, that's right. Vitamin K is used for clotting factors when we cut ourselves to help things heal. And actually, that's also very good for your skin and some cell membrane things. Vitamin E, that is actually our kind of like defender. In our cells, you can see on that first one, all those little things that are happening all the time. You can get little, I guess, troublemakers, we call them. They will damage the cell. They're little particles that can damage the cells. And the vitamin E will try to get rid of those things that we don't want, those little things that are out there trying to cause some damage. So that's great for our immune system, and it's basically an antioxidant, they call that. And of course, with the exercise, we do need exercise. This is just saying that our strength training, the muscle toning, that sort of thing is very good, especially later in life, because we do not want to have our muscles get really thin and atrophy or get a lot smaller. We're going to need the strength for endurance. The strength training also helps with the bone density. Exercises that promote flexibility, things like yoga and that sort of thing, actually help with balance, and they do help prevent against Alzheimer's disease. So that's very good. One of the exercises, or a couple of the exercises they say specifically for Alzheimer's disease, is anything that coordinates the side-to-side movement. So it can be as simple as, say, if you're marching, an exaggerated march. So say if you normally walk a block or two, and instead of just walking like this, the best thing is to walk like this, so that your body is trying to correlate what's going on from one side to the other. That actually can help prevent against Alzheimer's disease. Another one they say is walking backwards. It just gets your brain to kind of focus on movement and coordinate the brain activity with the muscle activities, trying to teach you something new. Another thing that really helps with everything actually is stress management. If we are under stress, repeated stress produces cortisol. That's another hormone. Cortisol is usually used for a flight or fight response. That's great when we need it, but if you're under stress constantly and your cortisol is being produced high levels all the time, that's going to cause a lot of damage to your cells. It increases cholesterol. It doesn't let you sleep. You can't heal properly. Things like that occur. You're going to gain weight. Your cholesterol is going to go up. So we don't want a lot of stress constantly. I mean, it's good if you're taking a test and you got some stress. That's fine. But or if you're doing your taxes coming up here, that's not good. That might last for a while. Yeah, So things like that we want to avoid. So I'm going to show you just a couple of things here. Does anybody know what mindfulness means? Mindfulness just means trying to be present in the moment, realizing where you are at the time. If you're just, like, say, sitting outside on your back deck, instead of thinking, oh, I have this bill to pay, or oh my gosh, I have to run into the store to get all these things, or I have a project coming at work. Instead of having all those things flood your mind all the time, one of the best things to do is, if you're sitting still, grab a notebook and write all that stuff down so you get them out of your brain. You don't have to think about them for the rest of the night until tomorrow when you're going to get stuff done. Write them down, get them out of your brain. And then if you're sitting, say, like on the back of the deck, look at the scenery, think of the noises you can hear at the time. Is it cold? Is it hot? Feel the weather. Just know what's going on in your moment at that time. That releases a lot of the stress. The cortisol isn't being produced that way. And you just realize what's present then. So that's what they mean by mindfulness. But that helps to get rid of the cortisol. Another thing that helps is deep breathing. So breathing is really important. So it helps a lot of things. It releases stress. It helps your mood. It can get rid of anxiety. And this one exercise can help get rid of anxiety right away. Usually when we have a lot of anxiety, you're breathing very shallow, so that your chest, the top of your chest is going like that. So all these things send chemical signals to your brain to tell your brain what's going on, and then your brain sends stuff down, and if you're doing that, it'll send things to your brain, and your brain says, oh, I need more cortisol. We don't want that. So if we just want to calm down, one of the things you can do is deep breathing. So if you take a deep breath, so that it's kind of hard to do, maybe you can try it. Have your stomach, take a deep breath so your stomach goes out. So you have to pull your diaphragm down and have your stomach come out like that. Can you try that? It's really hard. And then when you take a deep breath and get your stomach to go out, you count to 7 and you let it out there for 7. And then after 7, you breathe out. And you're supposed to count to 8 on that. So in for 4, hold for 7, breathe out for 8. And you try to repeat that. Again, that releases a lot of stress, anxiety, and it does work very well. I mean, if you're thinking about going into, do a presentation, you could, and you're like nervous and sweaty, you do these and the anxiety immediately dissipates. So just keep that in mind. A lot of times you can use this before you go to bed too. Sleeping is really important. You may want to take that notepad and put it beside your bed, write down all the stuff you're thinking before you go to bed, because that gets it off of your brain so you don't have to think all night. Oh my goodness, I got to remember that in the morning. I got to remember that. Oh my gosh, I got to pay that bill. But if you sit and write all that stuff down, get it out of your head, and then when you're ready to go to sleep, you try some of the mindfulness or the deep breathing, that really helps promote a more restful sleep.
I play a lot of games on my laptop, you know, which are, well, I guess, but I do the informative, the educational, the, you know, that
Okay,
not.
okay.
So, I mean, that calms me down and whatever, and, so, play a lot, but, I mean, I'm retired and supposedly, but,
Well, those things are certainly beneficial for your brain activity, and they do help a lot with preventing Alzheimer's disease. But the screen time is of some concern for your, what we call your diurnal rhythm.
Yeah.
Meaning, when you get up in the morning, you're supposed to see a lot of sunlight. That actually helps you produce melatonin, or it stops the melatonin from being produced. Melatonin is a hormone that's produced in your brain in response to light and not light. You should have a lot of melatonin when you're going to sleep. So as the day goes on, you get a lot of melatonin produced, and then overnight it drops. And then, you know, that's what promotes your restful sleep. If you watch a lot of screen time right before you go to bed, that's going to stop your melatonin from being produced.
the melatonin's too high, right?
It'll decrease your melatonin,
Oh,
so
decrease.
it'll keep you awake. Your brain says, bright light, bright light.
Oh, okay.
I'm not going to sleep, that's what it says. So you can try using some of those blue blockers type of things,
Yeah.
but it's good to try to avoid a lot of screen time, you know, like say within an hour before you go to bed.
Oh, yeah.
But the blue blockers can help. Or the
But-
dim your screen.
I don't go out a lot, especially in the hot sun in the summertime and whatever. So I indoors mostly, but,
Okay.
no, I just, I also, you know, have brain active, you know, like watch the news and keep up with current events and so on.
That
Not
might
that I
be
can do
producing-
anything about them, but just to be, to
That might
know
be
what's
producing
going
too much
on.
cortisol.
That was what's increasing.
That may make it produce too much cortisol to
Yeah.
watch the news.
Well,
But when you sleep, that's when your body can repair all those damaged
Yeah.
tissues. You have to have a really good sleep to
Sure.
keep healthy. And I'm not sure if you noticed, even after one night of not sleeping, it's going to affect you the next day.
Oh, yeah.
You're going to feel tired. You're not going to feel like being your best, and
Right.
you know, sleep is very important. One of the things that really helps with the sleep-wake cycle is getting up and looking at the sun right away. 15-20 minutes of sunlight in the morning does a lot to have good energy for the rest of the day. So that lets your brain know, I'm up, it's daylight, let's get on the ball. So, and of course we all know hydration is important. It should be routinely 64 ounces of non-sugary, non-caffeinated beverage. You know, obviously you can have more or less or some other varieties, but that's what's recommended. And we just went over sleep. Sleep is very important for cellular repair. It helps you restore your cognitive function, helps mood, helps energy. And we'll just go over the labs that we like to monitor. Blood count, that tells us whether or not that has the hemoglobin, hematocrit, the white blood cells. That tells us whether or not you have an infection, make sure you're not anemic, can tell us if you're deficient in some of the vitamins, tells us if you're healing or clotting well because the platelets are in there. A comprehensive metabolic panel, that is that long thing you usually get with all those different names in it. The first one is the glucose. The glucose, of course, we want less than 100 because once we get above 100, we'll get concerned about either insulin resistance or diabetes. Insulin resistance is kind of like the precursor to diabetes. Your sugar's normal at this point, but your insulin levels your insulin levels a little higher because it's not getting into your cell to help the glucose get processed correctly. That's what we mean by insulin resistance. Diabetes is when your sugar is very high, but right before your sugar gets very high, your insulin is high because your body's trying to have the sugar degraded for energy, but your insulin isn't working right to do that. So your body says, oh, I have high sugar, I have sugar here, I need more insulin. Well, it produces the insulin, and the insulin goes to your glucose, and it says, I don't see it. So, but the sugar's still sitting there, so your pancreas says, oh, I need more insulin. So your insulin goes up, and eventually your sugar will come down, but it doesn't do it right away, it's really slow. That's where you actually can see some low sugars, because you produce all this insulin, and now it's just gonna work on that little bit of sugar you had earlier. So that's where you can see lower ones, usually in the beginning when you have insulin resistance. It also has markers for your kidney health and your liver health, so those are two very important things for detoxifying any kind of infections or chemicals it processes, medications and things like that. Let's see. Of course, we need to know what the cholesterol panel is. The good, which is the HDL, the high density lipoprotein. We want a lot of it, so we want high amounts, so that's the HDL kind. The LDL kind is the bad kind, which will actually be incorporated into the blacks. We don't want a lot of that one. And again, we need some, but we don't want it overbearing, so less than 100 is best, less than 130, we're getting worried, but we'd like it less than 100. The HDL is very good because it can actually get rid of some of that extra bad cholesterol that floats around in our plaques, in our vessels and can form plaques. The other thing is triglycerides. They're actually from having problems with your sugar. If you have a high sugar, you're going to tend to have high triglycerides. But we'd like to keep it under 150 for that.
How do you raise HDL?
Exercise can raise HDL, and there are a couple medications that can raise HDL.
How about foods? Any particular food?
Let me see. I think it's lean meats and things like that. Legumes and nuts, beans.
Okay, all right.
There are different kinds of protein or different kinds of cholesterol now they have that they were testing for, which they're more minute or it's just smaller particles, but they can test for those. They're not always mainstream, but I just put them up there, the ApoB and ApoA1, which are just smaller particles.
How do you lower the triglycerides?
Low fat, low saturated fat diet and exercise and weight loss. There's a couple other markers. Your body does not like those free radicals I was telling you about, the vitamin E. That vitamin E can defend against. Another thing it does not like at all, your body does not like inflammation. We have a couple markers of inflammation, like the high sensitivity CRP. That's not ordered routinely. Sometimes it's just because the insurance companies don't like to pay for that one, but that could be a marker. We do like to take a look at it. And there's another one called homocysteine, which is another marker that you have a lot of inflammation. And we'd like to reduce those. So some of the other things we check for on the lab work is your hormone levels. We know now with more recent data that it's best to have hormone levels that are optimal or at the ranges where we would like them to be when we were like age 30. In women, the hormones start to decline rapidly after age 30, and in men after the age of 40, they start to decline rapidly. But we know the hormones, the estrogen or the estradiol, the testosterone, thyroid hormone, and progesterone actually prevent diseases like heart disease, diabetes. They can prevent osteoporosis. Some of the newer studies show they can help prevent against prostate cancer and breast cancer, actually, unless you're estrogen 2 receptor positive breast cancer, but that's a different story. But for the most part, we want those hormones optimized at good levels. Sometimes there's another issue with the men testosterone where it drops way early. That's the low T, they call it. The testosterone we would like to see between usually 300 and 1,000, and normally when we're younger males it is like 700 to 900, but low T diagnosis is less than 300. We don't like to see that again because it causes depression, weight gain, muscle wasting, cognitive decline, memory loss, and things like that. So we want to keep it elevated.
What do you like to see in women?
In women, women actually, when we're younger, it has more testosterone than estradiol, and typical ranges are anywhere from like 1 to 400, but as you hit 30, it drops down a lot from there to like under 100, and after, when you hit menopause, it's way low. It's I don't know, sometimes non-existent, can be 12, but testosterone is still really essential for female health, because without that, there isn't, we like to have that for muscle strength, for energy, for less fatigue. Again, it does prevent against osteoporosis and inflammatory diseases, and helps to maintain weight. So it does a lot of good things.
But what level do you like to see that? When we get
For
past that?
we can go up to 250 for the testosterone for women.
I take it for all of that.
Uh-huh.
It does make you feel 100 times
Yeah.
better. You know, for you.
Yes.
Unwanted hair, of course, but you take the good with bad.
Right.
It
Well,
definitely makes you feel a whole lot better.
yeah, and some people have concern you're going to develop like male sexual characteristics, but you don't do that with the levels that we use.
No.
But I think it's like 30 times what we use you'd have to take, but you don't get any male sexual characteristics. The hair growth is a little, most people tend to get a little more hair growth. So, you know, we do address that with laser, but people say, like you're saying, the trade-off for the feeling of the energy and the muscle strength and that sort of thing, and the decreased mood swings and the mental acuity and that kind of thing, is well worth, you know, trying to deal with some facial hair. So, yeah. So, and the other one is estradiol. We know that obviously menopause comes with low female hormones, estradiol and progesterone. Symptoms of that are hot, or night sweats and mood changes. Actually, things like the female genital area has a lot of atrophy, no lubrication, it's dried. Then sexual health actually suffers. But here's a questionnaire. I'm going to give you guys these. These are questionnaires that we give, like, for people to ask, and we ask if these are positive. We check all these labs to. Oops, sorry. I have the mail.
Oh, okay.
We check all these labs because one of the things we want to do, we don't want to wait until you have disease. We want to treat your symptoms. We want to make sure you're healthy, and we find out what's wrong, why you don't feel well. There's a reason you don't feel well, and you need to figure it out. But if you have these symptoms, we do get these labs because they certainly can impact the way you feel. Another one is thyroid disease. So thyroid is another hormone. It generally regulates metabolism, helps with mental clarity, moods, weight loss, and things like that. Your thyroid hormone affects every body system. It kind of determines how fast it is, how slow it is. So if you don't have enough thyroid hormone, you get fatigue, weight gain, kind of depression, or we call it dysthymia. You just don't really feel like doing anything, but you'll go through the motions. So we do check that. We do a panel for the thyroid because everyone checks a TSH. A TSH is a precursor and not the actual hormone. So just because your TSH is good does not mean your active T3, which is the working thyroid hormone, is normal. So, because a lot of times on screening tests, they just do a TSH, which means thyroid stimulating hormone. But that's actually not good enough for us to know whether or not your thyroid is functioning okay. We still have a lot of people with those symptoms whose TSH is fine, but they're still low thyroid because the T3, which is the actual compound that works, isn't high enough. And we do extensive testing to check for that when people have symptoms.
How do we know what test to ask the doctor to have us take?
that's not your job. You just go in and you say, I feel this, and they should
Yeah.
know what to do.
Yeah,
So that-
but as far as blood tests go, you can do a lot, you can do some, whatever. How, because we have annual physical, I see him twice a year, and he does all these blood tests, which is fine, insurance was paying for, or whatever. But that's one thing the insurance companies are cutting back on which blood tests to do. And so how do I know, well, I'll pay the few extra bucks or whatever, but I want this blood test done. And,
Well, you could tell them you want your hormones checked, because, I mean, then they could do a panel, but a lot of times, you're right, insurance aren't paying for it. So, at my office, we have, we do a blood test that does everything that I'm mentioning for, the insurance is not involved at all. It's just us in the lab have, made an arrangement, and that's like for $100 for everything. But your insurance won't pay for those, and so you'd have to, you know,
but it only costs $100 or so? I mean,
from, at my office, yes.
all right, no, but I'm just saying, I'll easily pay the $100 if it avoids, like a hospital is what, $2,000 a day?
Yes.
You know, 3 days, 4 days, 5 days, and whatever, and I'd rather pay the $100 or so if I get, you know, like cancer, like, you know, like Parkinson's and, you know, whatever, or, you know, what, any blood test for, you know, any type of cancer that there's no, you know.
Well, that's a different story. That you have to get specific cancer markers, and
Yeah.
they are a lot more expensive. So,
Okay,
and they wouldn't do those unless they have some indication for them. So they feel that you have a specific concern for a particular organ that may have cancer. You know, say like, for example, if we think you have prostate cancer, we get a PSA. There's other ones, if you have liver cancer, we test for certain things. So that's different. If you have cancer, that's a different type of thing. But with these tests that we're talking about, that's a whole panel for the $100. So there's also tests like saliva tests and other things like that that you can arrange to get. Sometimes, again, those costs are variable, but those things are out there, and arrangements are being made otherwise because we know insurance doesn't pay for them. But we want to address it because people don't feel well, and we want to prevent chronic disease and disability toward the end of life. So we're trying to make other arrangements while we work on insurance companies to get them to pay for health care and not disease care.
Yeah, well, if they do more blood tests, you know, to
Yes.
prevent the problems from, you know,
Yes.
rather than, like, my insurance pays 100% hospital and what's paying 100% of doctor. So, but, you know, if they say, well, we could save $10 here by not doing this blood test, but it shows up down the road, you know, $2,000 a day in the hospital, you know, or whatever, plus surgery, plus doctors, plus, you know, all that other stuff, you know.
Well, I think some of the health insurance industries and the pharmaceutical industries have another line of thinking. So they're working on different
We have
things.
another lineup.
They're not really interested in preserving health. They would rather treat it when it's not good,
Why that,
because there's profit elsewhere.
yeah, and that's
So,
the head of health insurance that paid for it, you know. 'Cause
yes, they should be, like I say, they should be paying for health care and not disease care, which we have to work on them.
Yeah.
So we have to get that changed.
Meanwhile, they're working on Congress to let them, you know, all these drugs get approval, quick approval now. Now it used to be FDA had to do it, now they let the drug companies do it. Yeah.
That's right, that's right. They're pushing them through fast because of the funding. But we're trying to get it to be otherwise, so that the health insurance is health insurance related rather than working with pharmaceutical companies and things like that. So, and just one other thing that now, At this point in time, you know, a lot of this information, again, we haven't really had access to or known about, so in the past 10 to 12 years is when a lot of it's been coming out. There are other treatments that we can use to repair and heal tissue, like PRP treatments and stem cell treatments or exosome treatments. They actually help damaged tissue, reform new tissue, and heal, rather than just, say, for example, we do them in joints, and if we did just a cortisone injection, it just reduces swelling and inflammation. We don't want that, because that doesn't improve anything. We're going to give you something that actually regenerates or rejuvenates the joint with good, healthy tissue. Another thing, we have a lot of treatments that will rejuvenate things like vaginal tissue even, that once some people have gone through the menopause state and they didn't have enough estradiol, and things happen where there's dryness, there's painful intercourse, and other things like that. And actually urinary incontinence is a big one. So we have treatments that will rejuvenate those things to help get rid of those kinds of things like dryness and urinary incontinence. So we're trying to provide a lot of treatments to rejuvenate or regenerate new tissue also, and take the clock back actually. Does anybody have any questions? Yes. Yeah.
What about those like or whatever that you put on your face? You know, that's estradiol and all that other stuff.
You mean creams or lotions or things like that, or gels?
Yeah, prescription based or something.
Yes.
Like that. How do they? Is it just a fad, or is there medical?
No, it is not a fad.
Okay, so
They again.
Now, do you do that? Do you prescribe that? Because I know it doesn't cover under insurance.
Yes, I do prescribe it. There are, I have brochures up here for the office if you want to take one, but yes, I do that. I do a lot of regenerative medicine and weight loss, hormone replacement, optimization, a lot of other things, but it's in the brochure. But yes, we do that. It's not a fad. The past 10 to 12 years, they've done a lot of testing to show that it actually, again, prevents a lot of these diseases like Alzheimer's, osteoporosis, diabetes, heart disease. It helps prevent them.
Oh, I know. I take
So,
Biote.
oh, okay.
Yeah.
Oh, okay.
So,
all right.
yeah, I just didn't know if you did the prescription. For
Oh,
that and
yes, we can do the
I have
prescription.
an appointment next month with you.
Oh, okay. Yes. We
Okay,
do the
we'll
prescription
discuss
stuff
that then.
also.
Okay.
Mhm. Yep. It's just the creams, lotions, and the things you put on your skin are more variable for absorption or their activity.
That's what I was wondering about, because does it really absorb on your face to make a big difference? Or is it kind of like,
Well, it can, but.
based on the absorption rate? Because I think the skin absorbs, different parts of the
Yes.
skin absorbs better than others.
And again, that's why we have to check or monitor labs and that sort of thing. For the creams and lotions and gels, they can also be absorbed onto other people. And the progesterone cream, I don't believe, works well, especially if you have a uterus, because once we give you estradiol, we have to prevent against other problems with progesterone, and I don't think the progesterone cream works well for that. So there's certain nuances you have to pay attention to get the creams. Any other questions? Yes, ma'am.
The diabetes, the cholesterol, high blood pressure, is that a lot based on hereditariness?
It does have some hereditary factors, but a lot of it is on what you're eating, how you're exercising and things like that, because we can have two people doing the exact same thing and one has the diabetes and one doesn't because of obviously the things they've chosen to do. Like if someone eats all processed foods and McDonald's, then they have the gene, the diabetic gene, they're probably going to get diabetes. But if you got somebody who eats fruits and vegetables and lean meats and proteins and exercises every day, they may have very, very low incidence of getting it. So it's not necessarily inevitable because your mom had it that you're going to get it. But you just have to do things differently. Anybody else? Okay.
Well, it's door prize time. Are there any more slips?
Here.
Yeah, fold them if you would. Any more?
There's
And
some.
We may not have enough of these for everyone, so those of you that have a phone, you can take a picture. Maybe you snap a picture of this laying here, and then some of the others that don't have that set up could take a hard copy, just an idea.
If you have any particular questions and you want us to get back to you, if you want to write your name and phone number on that paper I gave you, and you can give it to me, and we'll take it back and get back to you on it.
This with this address?
Yes.
We'll mix these up and then
Yes,
I
our
gotta
email
find
address
out
is on there also if you want to
a
contact us.
volunteer who
This
can-
is you up in the corner here?
Yes, ma'am.
Could you be so daring as to draw one?
I'll draw one.
If it's your own, I can't defend
I,
it.
that's okay. I'll let you.
Let's see. Oh, it's me. Oh, no, sorry. It wasn't me. Brenda Kreider.
Wasn't there today, right?
You're the winner. I got a small little treat. Little prize. And maybe I have to take it in the back.
I know, it's rough. Yeah, it's not fun.
Could I ask you a question? Or a medical doctor, but do you also deal with people holistically or naturally or something? It's just not all drugs and medicine?
Yes,
Yes, what?
yes, I do treat people holistically and not all with drugs and medicine.
Yeah. Okay.
That's correct. I do both, but yes. I don't like to use medicine if we don't have to, of
Yeah,
course.
I-
Yeah.
She has busted it off, and I said, okay. That's good. She said she would. That's like,
And what would come up off the sheet?
I don't know. Other people are leaving.
No. I mean, if you want to hurt other than the reference or whatever.
okay. It's not fun. Stop it right now. Estradiol doesn't affect that anymore. They've done some testing.
You take a multivitamin?
No problem.
Yeah, I did just say, I've been doing it for years. I didn't know. Oh, I'll get it. Her brochure.
But yeah, you want to stop that before it gets better. Thanks for coming. Thank you for doing
Okay. All right, thanks. Sure.
Yeah, I think there's other things I wanted to
It's only downhill. Don't say that. If you don't, I'm telling you, if you don't stop it. 30 minutes, that's not enough. Well, it doesn't smoke or You can include things like, your stuff, housekeeping. If you're doing stuff, and your heart rate's at 130 or something, that is considered excess. Those things hurt. Okay. She'll definitely be there tomorrow.
I message you.
Call her. She's standing up at night for
Take care.
Or I can take your name and number and have my office manager already call you.
Next month, I'm not sure. Yeah, one every month. And if you want to they come out each month. February has already been published and distributed. But if you stop in the pharmacy, they probably have something.
Yours says 298.
Yeah. Do you have email? They can set you up for it. They'll come to your email every month automatically.
741.
And then you get it ahead of time. You can take a plan.
Oh, okay.
Thanks for
That's a good
coming.
number. How'd you get that?
I don't know.
All right. I'll talk to you tomorrow. Bye-bye. Hello, how are you?
Do you have stem cell thing for the joints too?
Right now, we're doing the exosomes, which are kind of like lab processed stem cells.
Okay, you do it in joints and improve. Is that, because I think I have, well, I definitely have like tendonitis. Does it help with tendonitis? Okay, do I have to do x-rays first or anything like that? How does that work?
Depends on your symptoms, but not usually. I mean, as long as you don't have, wasn't some tragic injury or things like that.
No, it was just right
further.
Yeah, I tore the labrum.
No,
Okay, and it'll heal it? Or it should get better?
it should get better.
Because I have it like all here, like here, here. I got something in my back that.
We can't inject back without fluoroscopy, and I don't have fluoroscopy. That's it.
Oh, I have one.
I can't do
My
like your
husband got it.
second.
Yeah, I'm fine. If I can do this and this, I can run again, so that would be
Okay.
super helpful.
Okay.
So talk about it. 'Cause
Okay.
I gotta wait in for a couple weeks. I
Okay.
can't wait. 'Cause you should have my blood test by now too.
Okay.
I love the testosterone. It's pretty.
That's what a lot of people say,
Yeah.
including why it's supposed to be.
Yeah, my husband loves it more than I do.
You can check the pellets. Is that what you do?
Yes, that's what I do.
That's what I do too.
Oh, okay.
I just go to Hagerstown.
Oh, no, I mean, you can.
So what do you charge them for the pellets?
It depends, but $450 usually for females, every 4 months.
Therefore, I go every 3 months now.
Well,
Because I can tell at the end of my 3 months that I need it again.
Okay.
That would probably be worth me not running to Hagerstown, because I only pay $350 there. And that gives me my estrogen and my testosterone. Yeah.
Yeah, just, do you want me to take your name and number and have Lori call you? My office manager.
I have it. Is
Okay,
it?
all right,
Yeah.
give us a call.
Yeah,
My friend pays $350 every 3 months too. And
yeah.
that's
She
it.
probably goes to Hagerstown.
Well-
No, she goes somewhere like near Harrisburg. She lives somewhere.
Well, that, I mean, that's, like I said, that's 4 months, so I don't,
Oh, wait,
So it's a little bit cheaper.
what's a little bit? Yeah, but 4 months.
if it's every 3 months, it's
So
less.
you work for Wayne?
Yes, I do.
Oh,
It's
okay.
less.
Yeah,
It's less.
it's good.
Oh, he's a nice gentleman.
He is very much so.
Very great. I pay less than what you
Informed, yeah, good.
but it's only 4 months that you do it, right? I mean, so,
So for the year, that turns out to be $1350, but
Right.
are you paying $350 every 3 months, right?
correct.
So that's the same amount.
Yeah, but I don't know if I could go an extra month without not getting
Well,
it.
I'm not saying you have to, I'm just saying we would do, based
Picking
on
up
what
all
you
the
need.
Oh,
newspapers.
gotcha.
Yeah,
But it's
Okay.
$450 each time you get done.
not if you're coming that frequently.
Oh, so you pay for a year in advance, is that basically what you do?
No, not for a year, but because it's the certain amount of estrogen and testosterone we have to use, that's usually what determines, but if you're coming every 3 months, it's not $450. It would be less, so.
Okay, so probably about what I pay now.
$50 less a year.
done.
Okay.
per month going to her versus.
Well,
what you're
right, but I still wanna do it every 3 months, I
And you
think.
could,
Okay, why do you do 4? Just out of
Yeah,
curiosity.
just because that's what, most of the data suggests, the pellets will start to gain on.
doing. Oh, I'm feeling it already.
How long has it been for you?
Some people do it every 3
3
months.
months.
Yeah, see, I can tell.
So,
Again,
again,
I could be sick. I don't know. And it's my, how long have you been doing it for?
Year and a half.
Oh, I've been doing it just 3 months.
we treat based upon patient symptoms.
Yeah.
If you're having symptoms, if the symptoms are returning, then we do it sooner.
Right,
I mean,
right.
we don't say, oh, you can't, then it's not the
Yeah.
time.
Okay. Where's your office at?
In Waynesboro,
Okay.
by Tractor Supply, it's in the Wealthy Medical Center.
Okay, you know what, I think I have had people mention you before.
Across
and-
from
I bet you I have. Okay.
Andrew Park.
I also have a question. This is kind of out in left field. So I have a friend who can get you German Botox and half off because she works for the company. Can you inject it in if I give you it?
Yes.
I'm gonna buy a box.
She works for Allergan or AbbVie.
At Beach, yeah, yeah. And I'm like, friends and family discounts? Like, yeah. I'm like, oh, yeah. She's like, all right.
Why would she give you it, though? You think she
cost?
you think she wanted to do it for you then?
She'll do it for free.
Oh.
But she lives in DC, and I
Oh.
don't wanna go there. So I'm just like, just relax. So I gotta
I
work
need
it
a
out.
friend like that.
Do you want to be her friend? It was actually the husband. I'm like, what's your wife do? She's like, she's an anesthesiologist, but she works for AbbVie, and I'm like, can I be her friend? He's like, yeah, sure. And she was sitting right next to him, and I'm like, can we go out for coffee? And she's like, yeah,
Let's talk,
absolutely.
yeah.
Yeah, because the husband likes me, and so talks good things about me. So
Well, that's wonderful.
that's a good
Yes.
friend to have.
Yep.
There's estrogen that's on your face for wrinkles.
Yes.
Oh yeah, what is it called?
Well, extra test. Are you talking about that?
Hi, Wayne.
Oh,
Hi
no.
there. How you doing?
Good.
There is. No,